Hello, everybody, and I thank the organizers of this platform, TEDxChowringhee, for giving me an opportunity to be with you. Uh, we are talking about situations and possibility which can then turn into a reality, and that has been the story of my life. As a medical student, I realized that the possibilities that my medical education allows me to actually deliver to the people who need and can benefit from that knowledge are in reality stopped by various other factors which are not related to the possibilities of the knowledge that I have, primarily the economic constraints. So it got me thinking, and in my studies as a medical student, I started to build bridges with other doctors and members of the medical fraternity who were applying their mind to these challenges and had been doing it before me. The interesting part was that they had already established a great degree of reconciliation as to how to identify possibilities in medicine and how to actually convert it into a plausible reality. And the main challenge is that as medical science advances, as medical education and research progresses, there are numerous new beneficial ways of actually treating patients and achieving positive medical outcomes. But there's a cost to it. And the poorest of the poor globally, especially in India and in my state, West Bengal, many cannot afford the advantages of that knowledge. So, to look back at the entire history of how medicine has evolved and to go into that library of knowledge and actually pull out those books and those possibilities in the past which have relatively good outcomes, but at the same time, which are cost effective and actually fits into the budgetary reality of our patients and ends up giving a real possible solution. And it is these thoughts that stimulated me and a group of friends to start off our organization, Kolkata Swast Sankalp, which started off with a possibility and converted into a reality. We started thinking, how do we impact the lives of people who need help on a regular basis and in a concrete fashion? We zeroed in on how to provide low-cost dialysis to patients who suffer from end-stage renal failure. The sad part of the reality of a chronically affected kidney patient is that he knows, his family knows, his doctor knows, everybody knows that if he gets adequate dialysis regularly, he will most probably live his life as any other person. He will have the same quality of life and he will have the same period of life expectancy if he doesn't have any comorbidities. The reality is that if he can't afford it, he can neither achieve the quality of life nor the life expectancy that a good dialyzed patient can achieve. And therein lies the challenge because dialysis is costly. Those who can afford it, they get both quality of life and a good life expectancy. But we were focusing on those people who can't even treat their relatives and their patients at government hospitals because even in the government hospitals, there are ancillary costs. And that got us thinking about to set up our organization. So our core principle was to set up an organization that provides low cost dialysis in a sustainable fashion so that it is not just a one-off issue, a short-term period, but an organization that will be with the patient for a long time. When we started off in 2004, myself and my school friends basically, and some people who were common friends, we decided that we have to do this. We didn't have a building, we didn't have any sort of place, we didn't have any funds, but we just had the idea, the possibility of that idea, and the reality of healthcare in my country and in West Bengal. And putting that possibility and that reality together, we started off with uh, on a journey ahead. We initially targeted two other projects and two other ideas. The first being avoidable blindness, and the second being trying to get a blood donor connected through the emerging mobile technology with a patient who requires blood in the vicinity of the patient and the hospital that the patient is in. It was a triangulation method. We created a software and we received the first Social Innovation Award given by NASCO for our digital and mobile based app and connectivity between a potential donor who had registered himself into the system with a person who requires blood within the vicinity of the hospital rather than giving off blasts of messages to everybody. So geographically, what you call effective messaging was what our what we call software was targeting to do. The second project that we took up, while we were slowly building capacities of establishing a sustainable unit for dialysis, was the Avoidable Blindness Project. The Avoidable Blindness Project was to target those patients, as the words themselves explain, who should not be blind because it's absolutely avoidable. And we started working and getting those people treated. And we took up a unique project where our optometrists used to visit the poor and the needy at their doorstep, identify their disease process, and offer them a solution, including surgery free of cost. And there are 4 wards in Kolkata that we actually got cataract controlled because our sustained project worked for almost 6 years. And outside Calcutta, we had worked with a number of people, especially from Burdwan, from the Sundarbans, and North 24 Parganas. While we were doing these active projects, we kept on building our capacity for setting up the renal dialysis unit. We built up our structure, our building, and we started our dialysis unit in 2009. And we worked with a very, very practical business model. That is, the unit has to be a paid-in model. Either the patient pays into the system or somebody on behalf of the patient pays into the system, but the unit will run at cost and it will have to be paid in by somebody or the other. The principles that we identified were very simple. We would actually cut hospital from hospitality. We removed hospitality from the hospital and we call our unit a no frills unit because we do not have the frills of a hospital, which adds on the hospitality quotient, thereby saving huge costs to the patient. We realize in our experience that saving 10 rupees per dialysis for our patients at the end of the day ensures the number of 10 rupees that he saves allows him to live for that many extra days. And that is central to what we are focused on in our dialysis unit. The no frills, cutting the hospitality out of hospital, was one of the principles that we started off with. When we were discussing to set up the possibilities of a low-cost dialysis unit and what we could envisage as our reality, we in India, there was a huge debate between whether dialysis unit would be only part of huge multi-speciality hospitals because dialysis patients many a time require that additional support. But the number of kidney patients that we have in India, the entire nephrology fraternity, all the nephrologists in India concluded by the end of the first decade of the century that to set up a dialysis unit, if you have to have a 500 bedded hospital to support that dialysis unit, then the number of patients that we have in India would never get dialysis. And hence, we need to set up numerous standalone dialysis units, which will not be attached to a hospital, but will give dialysis, and the cost benefit ratio in medical terms will have to be accepted because dialysis gives more benefit vis-a-vis a crisis when a dialysis is being conducted. And when this was concluded, we were happy to set up among the first standalone dialysis units in India way back in 2009. And we started providing dialysis to the needy. And that journey itself is a story that needs to be understood because when we started off at 500 rupees for dialysis, and from there, as we expanded ourselves, we got advantages of the cost of scale and the economy of scale coming into play. We reduced it from 500 to 450, subsequently to 400 rupees per dialysis, and then we moved on to 350 rupees per dialysis. And during this entire process, we understood that our patients face immense problems while taking dialysis, not only in terms of costs, not only in terms of actually suffering the entire disease process, especially those patients who have comorbidities, but also within their family. And a dialysis patient, as we say, is not only an individual, but it's an entire family. So we started off a program called Khwaishe in Kolkata Swast Sankalp, which is a program where we allow the relatives of our patients to come in and enjoy a full day of what we call different games, different talks, and we give them a number of goodies, especially the children who come in, so that we create a psychological environment within the family that if you did not have a dialysis patient, then this day of enjoyment would not be yours to participate in. So in the entire what you call patient fraternity that we have, they have developed, especially along with their families, and their families and the young children and everybody keep asking them, when is the next program going to be organized? And we have this on an annual basis, and this is what we do for our patients. As we move ahead into the future, we were planning to ensure that we increase capacity. And as we were increasing capacity, starting off from 2 machines, we reached 8 machines. We were confronted with COVID. And the day the lockdown was announced, there were serious challenges that our patients faced in terms of getting to our unit because the lockdown actually stopped all forms of public transport. There were no trains, no buses, no taxis available. And hence, the patients to reach our unit had to spend a huge amount of money to book private vehicles to come and go back from the unit. And that was communicated to us on the 25th. That is the first day of the lockdown. And that very evening, we took a decision to reduce the cost of our dialysis to 50 rupees, the 300 rupees being given as relief to cover transport costs for the patients to come and go from the unit. And we've continued that, and we've announced that until the end of September, we will be continue to give that relief. So in this entire, what you call, journey of how we thought that this is possible and how those possibilities were explored and how we reached the reality of setting up our unit. Thank you for being with us and have a nice day. Be safe, wear your mask, wash your hands, and hopefully Corona will not touch you.